You know, something happens when you get older. It's not just the gray hair or the slower mornings. It's this realization that everything, your balance, your breath, your heart, even your strength, becomes more fragile than you ever thought. That's why today's story hit me hard. It reminded me of how quickly things can change in a senior's life and how easy it is to miss the signs until it's too late. So let me walk you through this episode, because there are lessons here that could truly save someone you love. A man named Richard, 61 years old, retired electrician, still spry, still proud, was adjusting a light fixture in his hallway. Simple stuff, 8-foot ladder, a task he'd done a dozen times over the years. But this time, something felt off. He later told the paramedics, "I got dizzy for just a second." That second was all it took. He lost balance, fell hard onto his right side, chest first onto a carpeted floor. Now when the ambulance brought him into the ER, he was talking, breathing fine, even arguing that he didn't need all this fuss. "I'm fine. I can walk. My wife overreacted." But you see, the medical team didn't brush him off, and thank God they didn't. They immobilized his neck, ran a full trauma panel, ordered imaging, ECG, and cardiac labs, and that's where things got serious. You see, for seniors over 60, a fall like this isn't just about broken bones. It's about why the fall happened and what it caused inside the body. When Richard mentioned feeling dizzy before the fall, doctors immediately started looking deeper. Was it cardiac? Neurological? Could it have been a mini stroke? Or maybe a sudden drop in blood pressure due to dehydration or medication? These are the questions that must be asked, especially when dealing with older adults. One of the most common causes in these cases is vasovagal syncope, a fainting episode where the body suddenly lowers blood pressure, often in response to pain, heat, or stress. Sounds harmless, but for a 61-year-old man standing on a ladder, it's a recipe for disaster. Now here's the part that really hit me. The CT scan showed no immediate brain bleed, no broken neck, but it did show 2 cracked ribs and a small hemothorax. That means bleeding around the lungs. At the time, it was minor, but over the next few hours, Richard's oxygen levels started dropping. His blood pressure began to fall. He went from smiling to confused, from alert to lethargic. The bleed had worsened. He needed an emergency chest tube to prevent lung collapse. And that right there, that moment, that's where so many families lose precious time, because they think, well, he's walking, he's breathing, he must be fine. But he's not. This is what I want you to take away from today's story. For those of us entering the later chapters of life, or caring for someone who is, we have to shift how we respond to injury. For a 30-year-old, a fall might mean a bruise and a sore ego. But for a 70-year-old, it could mean a punctured lung, a silent internal bleed, or worse, a hidden cardiac episode waiting to strike again. This is the wisdom that only comes from watching it unfold up close, from hearing story after story where the signs were there, but no one knew how to read them. I want you to imagine for a moment what could have happened if Richard had gone home that day, if the ER team had shrugged him off, if his wife had listened when he said, "Let's just sleep it off." We've seen it too many times. A man closes his eyes for a nap, never wakes up, and the family is left wondering why. That's not an overstatement. That's a reality for thousands of seniors every year. And it's not just the fall that kills, it's the infection that comes after the fractured rib, the pneumonia from shallow breathing, the blood clot from lying still too long. It's the slow, quiet decline we mistake for simple aging. Now here's where it gets even more personal. Seniors often downplay their pain. They don't want to be a burden. They say it's just soreness, or don't make a big deal out of it. I've heard it from my own father, my uncles, neighbors. But pain in an aging body is never just pain, especially chest pain. and especially after a trauma. So when someone says, "I just feel tired," you dig deeper. When they say, "I'm a little short of breath," you get them help. Don't wait for it to get worse, because by then it might be too late. Let's also talk about rib fractures for a second. A younger person might shake it off, but for seniors, those cracked ribs can be a gateway to complications you wouldn't expect. Breathing becomes painful, so they breathe more shallowly. That shallow breathing leads to partial lung collapse, a condition called atelectasis. That in turn invites infection. Before long, what began as a sore rib turns into a case of pneumonia. It spirals, and it's preventable. Something as simple as using an incentive spirometer, a plastic device that encourages deep breaths, can stop that chain reaction. But most seniors are never given one. Most families don't even know to ask. And that's what needs to change. So here's my plea to you. Not as a doctor, not as a content creator, but as someone who deeply cares about our elderly community. Watch the small signs. Trust your gut. Advocate for your loved ones when they say they're fine. Because sometimes, fine is a whisper from a body that's quietly breaking down. The lesson here is part of what we call elderly reflections. Not just stories, but life lessons from the elderly themselves, through their pain, through their recovery, through their silence. And if you're still with me, I want to thank you. Because this kind of content, it matters. It's not flashy, it's not entertainment, but it's truth. And truth can be a light in dark moments, a compass when you don't know what to do. So if this resonates, if you want to keep learning with me, reflecting with me, growing wiser together through these real stories, please take a second to subscribe, turn on the bell. You ever sit by someone's hospital bed and watch their chest rise and fall? It's something we all take for granted, breathing, that quiet rhythm, in and out, like waves lapping on a shore. But for seniors, especially those over 60, sometimes that rhythm changes before anyone notices, and sometimes by the time they do, it's already an emergency. That's exactly what happened next in the story we've been following. Richard, the 61-year-old man who fell from the ladder, he was resting, seemed stable after the initial ER workup. But a sharp-eyed doctor noticed something small, a change in his oxygen level, a quiet tension in his breath, a slower rise of the chest. When they checked again, the bleeding in his lung had increased. The hemothorax wasn't so small anymore. It had become serious. His chest cavity was filling with blood, crushing the lung and starving the body of oxygen. His blood pressure dropped. His lips began to pale. The nurses called it out. Test tube now. This is where real emergency medicine begins. No second guessing, no waiting for approval. The team prepped the chest tube, 20 French, which in layman's terms means large and fast draining. They got ready to relieve the pressure on Richard's lung before it collapsed. And here's what stuck with me. Through all this chaos, one young doctor was eager, too eager. She wanted to perform the procedure. It was clear. But excitement and inexperience are a dangerous mix in the ER. She made a critical error, dropped a sharp, fumbled with equipment. And in the chaos, she injured herself. It was a bloody moment, not just physically, but emotionally. Now they had two patients, Richard and the doctor herself. This part of the episode might seem dramatic, but for anyone who's ever worked in healthcare, it's painfully real. One mistake, one exposure, one slip, and now you're in a completely different crisis. So let's break this down. What does this mean for us, especially the elderly and those who love them? It means that breathing changes, even subtle ones, need attention. If you or someone over 60 begins to breathe faster than usual, feel winded at rest, or suddenly can't take a full deep breath, it's a red flag. You don't wait for chest pain. You don't wait for collapse. You speak up. In many seniors, things like small rib fractures, minor trauma, or even fluid buildup from medication or congestive heart failure can press against the lungs slowly, silently. There's a term for this: insidious onset. It means it creeps in, undetected, until it's too late. In the case of Richard, it took one recheck, one moment of noticing a change in saturation to realize things were going south. And if they hadn't caught it, he might have coded. That's why senior health is so delicate. The older body doesn't always react with sirens and alarms. It whispers, and those whispers, those shallow breaths, those slightly low oxygen numbers, are the language we must hear. This isn't just medical advice. This is one of those life lessons from the elderly. Because many seniors have been through this. They felt the fear of not being able to breathe deeply, of struggling to find air in the middle of the night, of silently wondering if it's anxiety or something worse. Too many were told to just rest, calm down, wait and see. What saves lives is understanding what breathlessness means and when it's more than stress. Now, just when we thought the episode had given us all the drama we could handle, they introduced a new patient. A young woman came in, short of breath, in a full-blown panic attack. At least, that's what it looked like at first. But when the story unfolded, it got much darker. She had gotten illegal cosmetic injections done in someone's living room by a man she found on social media. She thought it was silicone. She thought it was harmless. Turns out it might have been construction-grade material, and now it might be in her bloodstream. Now you might be asking, what does this have to do with seniors? Well, more than you think, because the truth is, cosmetic anxiety doesn't disappear after 60, it just changes. I've heard stories, women in their late 60s going to cheap clinics for fillers, men in their 70s getting unregulated testosterone shots, all chasing youth, energy, attraction, and I get it. In a world that tells you aging is a flaw, of course we reach for anything that makes us feel alive again. But here's the reality. When you chase youth through backdoor medicine, you're not reclaiming your power. You're risking everything you have left. In this case, the young woman's rapid heartbeat and breathing could have been a pulmonary embolism, a clot caused by the injection material entering the bloodstream, a clot that could travel to the lungs, block oxygen, and kill her within minutes. The doctors acted fast. They considered sedation, imaging, blood tests, and thankfully, in her case, it may have just been panic. But in the elderly, things are more complex. We don't recover as fast. Our vessels are thinner. Our immune systems are weaker. If someone injected something toxic into your body, whether it's your face, your hip, your back, the risk of systemic infection, blood poisoning, or organ failure is exponentially higher. So here's the truth, and I say this with all the love in the world. Aging with grace is more powerful than any injection. Dignity doesn't come from fillers. It comes from wisdom, from survival, from knowing who you are and what matters. At Elderly Reflections, we believe in senior motivation, not senior makeover, in inspiration, not desperation. Because what makes you attractive isn't how smooth your skin is. It's the stories etched into it, the laughter lines, the strength in your gaze, the calm that only comes from having been through the storm and still standing. And let me say this clearly. If you're someone who feels like they're being left behind by the world, if you feel invisible in a youth-obsessed culture, you're not alone. Many feel that. That's why communities like this exist. That's why we talk, reflect, and learn together as elders, so we don't lose ourselves chasing what we no longer need. Whether you're 61 or 91, the message is the same. You still matter. Your health still matters. And what you choose to do with your one precious life starting today still matters. Still. Now pause with me for a second. I want you to imagine being 75, maybe 82, sitting across from a doctor who's explaining something critical about your spouse, or worse, your child. And the first thing they say is a chart, a term, a scan. What do you remember? Nothing. Because the words don't hit, not until the pain is real. In this case, the moment was already devastating, but the way it was handled, too clinical, too slow to connect, made it even harder. And that's something I hope every provider watches and learns from. When a senior is in distress, clarity and compassion must go hand in hand. Our elderly don't need more data. They need to feel heard. They need to be guided, not overwhelmed. But the story didn't end there. The parents were asked about organ donation, and that's when everything became even more fragile. You see, their son had signed up as a donor on his driver's license. Legally, that was his choice. But emotionally, his mother wasn't ready. He was too young, she said. He didn't know what he wanted. And again, the healthcare worker responded with logic. He was 18. But the way he said it, it shut the mother down instead of opening her up. This is the heartbreaking dance we see so often in hospitals. The law says one thing, the heart says another. Now I want to talk directly to those of you watching who are in your 60s, 70s, 80s. Maybe you're a parent, a grandparent. Maybe you've already lost someone. And maybe you wonder how decisions like this should be made. Here's the truth that nobody tells you. The way you speak to your family today, while you're still healthy, matters more than any document. Because in moments of crisis, the paper says one thing, but it's your voice they'll remember. So talk about your wishes, talk about your legacy, talk about dignity. Don't wait until someone is reading your chart. Write your story in their hearts while you still can. That's one of the greatest life lessons from the elderly, that peace at the end doesn't come from silence. Comes from connection. And as if that wasn't enough to reflect on, the episode ends with a gut-wrenching moment. An elderly woman, 85 years old, is found alone, confused, waiting in the hospital hallway. No family at her side, no phone calls returned. The nurse tries to comfort her. "Where's my daughter?" the woman asks. No one has the answer. It turns out her caregiver, possibly her only daughter, may have abandoned her. There's no proof, but there's a feeling. And for anyone who's ever worked in senior care, that feeling is all too familiar. Elderly neglect isn't always bruises or broken bones. Sometimes it's simply being forgotten, left without follow-up, sent home with no one there, and that's what hurts the most. I remember when my own neighbor, Mr. Harold, passed away. He was 83, lived alone, kind eyes, Navy veteran. Every morning I'd see him sitting on his porch with a coffee and a crossword. One day he wasn't there, then 2, then 5. Eventually, a wellness check. They found him in his recliner, TV still on, coffee mug half full. He'd passed in his sleep. Peaceful maybe, but alone. And I still wonder, what if I had checked in? What if someone had called? That's the message I want to leave you with today, not just as part of Elderly Reflections, not just as a story, but as a mirror. To check in on someone, to ask, "Are you okay?" To remember that behind every quiet porch, every closed curtain, there may be someone waiting, someone who gave everything, love, work, time, and is now slowly fading without anyone noticing. We cannot let that happen, not to them, not to ourselves. And here's the final thought. If you're watching this and you're over 60, maybe you've lost friends, maybe your health isn't what it used to be, I want you to know, you are not alone. We are building a community here, a space for senior motivation, for elderly inspiration, for stories that matter. You don't have to be perfect. You don't have to be young. You just have to be here and still be willing to feel. So before you go, I'd love to hear from you. Where are you watching from? What did today's video make you feel? leave a comment, share your story. And if this content speaks to your soul, if you want more reflections like this, please hit like, subscribe, and turn on the bell. It helps this community grow. It tells the world that our voices, our memories, our experiences, they still matter. Thank you for being here. Thank you for caring. And remember, the greatest wisdom often comes not from what we've achieved, but from what we've endured and how we choose to pass that